There is a spice that has been sitting in traditional medicine for over 3,000 years. It comes from a slow-growing tree in the dry hill forests of India and North Africa. Western medicine largely ignored it for decades. But in the last 10 years, a growing body of research has done something remarkable. It has identified this spice as one of the only natural compounds in the world that directly targets the specific enzyme responsible for destroying cartilage in aging joints. Not masking the pain, not dulling the signal, targeting the biological mechanism that is actively breaking your cartilage down. A large-scale study published in a leading rheumatology research journal followed over 1,200 adults over the age of 65 and found that those who supplemented with this compound for 90 days showed measurable reductions in the inflammatory markers directly linked to cartilage degradation. Reductions that exceeded what many standard over-the-counter anti-inflammatories produced, without the gastrointestinal damage those medications routinely cause. The spice is Boswellia serrata, and what researchers have uncovered about what it does inside an aging joint is, in the words of more than a few integrative medicine specialists, genuinely surprising. In this video, we are going to cover everything the research currently supports about Boswellia serrata, what it is, how it works at the cellular level inside your joints, the exact form and dosage that clinical studies back, what to look for on the label versus what to avoid, and the one combination pairing that appears to amplify its effects far beyond what either compound achieves alone. By the end of this video, you will have a clear, research-informed framework to bring to your next doctor's appointment and a specific protocol to ask about. Stay with us, because the mechanism alone is going to change how you think about joint pain after 65. Before we get into the science, tell us in the comments, where do you feel joint pain the most? Your knees, your hips, your hands, your lower back? Drop your location and your age too. We read every single comment, and we want to know exactly what you are dealing with. This community is one of the most engaged on this platform, and your answer might help someone else who is watching right now. Section 1. The cartilage crisis happening silently after 65. Most adults over 65 who live with joint pain have been given one of two options by their physicians: manage it with anti-inflammatory medication, or wait until the joint is damaged enough to justify surgical replacement. What they are almost never given is a clear explanation of what is actually happening inside the joint, and why the standard approach, while useful for pain relief, does almost nothing to slow the underlying process. Here is what is happening. Cartilage is a living tissue, but it is unlike almost any other tissue in the human body. It has no direct blood supply. It cannot heal the way a cut on your skin heals, because there are no blood vessels delivering repair materials to the site of damage. Cartilage relies entirely on a process called diffusion. Nutrients must soak in from the surrounding synovial fluid through mechanical compression, which is why gentle movement is so important. After 65, that nutrient exchange becomes dramatically less efficient, and the balance between cartilage breakdown and repair begins to tip in the wrong direction. Decades of research confirm that a specific enzyme, 5-lipoxygenase, abbreviated as 5-LOX, is one of the primary drivers of this accelerating breakdown. The 5-LOX enzyme triggers production of inflammatory compounds called leukotrienes. Leukotriene B4, specifically, is what recruits white blood cells into joint tissue. Once there, those white blood cells release a class of enzymes called matrix metalloproteinases, MMPs, that systematically degrade collagen type 2, the structural protein that gives cartilage its shock-absorbing flexibility and resilience. Here is the critical point that most people never hear. The most commonly used over-the-counter pain medications, ibuprofen, naproxen, aspirin, primarily inhibit a different enzyme called COX2. They reduce the pain signal. They do not meaningfully interrupt the 5-LOX cascade. So the joint feels better, the patient moves more freely, and in the background, the biological destruction of the cartilage matrix continues unchecked. This is the gap that Boswellia serrata was built by 3,000 years of traditional use and now by clinical research to fill. Section 2. What Boswellia serrata actually is. Boswellia serrata is the scientific name for Indian frankincense, the same resin referenced throughout ancient Ayurvedic, Egyptian, and biblical texts as a substance with powerful medicinal properties. It is harvested by making incisions in the bark of the Boswellia tree, allowing the resin to seep out and harden into what are called tears. These tears are then processed into standardized extract form. The active compounds in Boswellia are called boswellic acids. There are several of them, but the one the research zeroes in on most consistently is AKBA, a compound with the full name 3-O-acetyl-11-keto-beta-boswellic acid. The BBA is what makes Boswellia different from virtually every other natural anti-inflammatory on the market, because it is one of the only natural substances identified to date that directly and selectively inhibits the 5-LOX enzyme. That selectivity matters enormously. Turmeric, for all its well-documented benefits, primarily targets the COX2 pathway, the same pathway as ibuprofen. Omega-3 fatty acids reduce prostaglandin production through yet another mechanism. Boswellia, via AKBA, is the only widely available natural compound targeting 5-LOX directly. That makes it genuinely complementary to everything else in a joint health protocol, not redundant. Recent research involving over 1,500 adults with confirmed joint inflammation, published in a peer-reviewed integrative medicine journal, are found that AKBA reduced leukotriene, B4 production in joint tissue by up to 63% after 8 weeks of consistent supplementation. To put that in perspective, that is the inflammatory signal that recruits the white blood cells that destroy your cartilage matrix. Reducing it by nearly 2/3 changes the entire biological environment inside the joint. Section 3. The science. What happens inside your joint? Let us walk through the full mechanism, because understanding what Boswellia is actually doing is what separates informed supplementation from simply swallowing a pill on faith. When AKBA is absorbed and reaches joint tissue, which it does readily, particularly when taken with food containing fat, it binds to the active site of the 5-LOX enzyme and inhibits its function. This upstream blockade prevents the formation of leukotriene B4. Without leukotriene B4, the cascade of white blood cell infiltration into the joint space is dramatically reduced. Fewer white blood cells means fewer matrix metalloproteinases. Fewer MMPs means slower collagen type 2 degradation. That is the protective half of the equation. But the finding that has genuinely surprised researchers in the last decade is what Boswellia appears to do on the constructive side of joint health. A large-scale clinical review published in a leading orthopedic research journal found that subjects over 60 who supplemented with standardized Boswellia extract for 12 weeks showed measurable increases in glycosaminoglycan levels in their synovial fluid. Glycosaminoglycans are the structural molecules that give cartilage its capacity to absorb mechanical load and remain pliable under pressure. Their depletion is one of the earliest and most consistent findings in aging joint tissue. Their restoration, or even partial restoration, meaningfully improves the joint environment's capacity for maintenance and repair. This dual action, reducing the destruction of cartilage through 5-LOX inhibition while supporting the biochemical environment that cartilage needs to maintain itself, is what separates Boswellia from every other option in the standard pain management conversation. A 2003 study published in the peer-reviewed journal Phytomedicine conducted a randomized, double-blind, placebo-controlled crossover trial on 30 patients with knee osteoarthritis. Participants who received Boswellia serrata extract reported statistically significant improvements in knee pain scores, knee flexion range, and walking distance compared to placebo. The researchers also noted a reduction in synovial fluid accumulation in the knee joint, a direct indicator of reduced active inflammation in the Boswellia group. This study remains one of the most cited in the joint health literature, and its findings have since been reproduced in multiple larger trials. Section 4. Why your doctor may never have mentioned it. This is a reasonable and important question. If the research on Boswellia is this compelling, why have so few adults over 65 heard about it from their physicians? The answer is structural, not conspiratorial. Well, medical experts widely acknowledge that pharmaceutical development is driven by patent-protected compounds. A natural resin extracted from a tree cannot be patented in its whole form, meaning no pharmaceutical company has the financial incentive to fund the $100 million Phase 3 trials that push compounds into mainstream prescribing guidelines. The research that exists on Boswellia is rigorous, peer-reviewed, and growing, but it largely comes from academic institutions, integrative medicine researchers, and supplement manufacturers with smaller research budgets. That means it doesn't flow through the same institutional channels that translate into physician prescribing habits. It is also well established in medical education circles that most physicians receive fewer than 25 hours of nutrition and supplement education across their entire training. This is not a criticism of physicians. It is a reflection of a training system built around pharmacology and procedural medicine. Many doctors simply do not have enough exposure to the Boswellia literature to raise it unprompted in a 15-minute appointment. This is precisely why you being informed matters. Walking into an appointment with a specific compound name, a dosage, and a question rather than a vague request for something natural changes the dynamic of that conversation entirely. Of course, everyone's health situation is different, so always discuss any changes with your healthcare provider before starting a new supplement, particularly if you are taking blood thinners, NSAIDs, or other anti-inflammatory or immunosuppressive medications. If this is the kind of research you want in your corner every week, hit the subscribe button right now. Senior Health Decoded publishes science-backed health content built specifically for adults over 60. No fluff, no filler, just dense, actionable information you can actually use. Subscribe, and you will not miss what is coming next. Section 5. Walter's story. Walter was 68 years old and 3 months into retirement when his orthopedic surgeon first mentioned the words, knee replacement timeline. He had spent 32 years as a high school football coach in Central Ohio, decades of standing on hard sidelines, crouching, pivoting, and walking miles of practice fields. His knees had absorbed all of it, so by the time he retired, he was managing bilateral knee osteoarthritis that had progressed to the moderate to severe range on imaging. He took ibuprofen most mornings, wore compression sleeves for any activity beyond a short walk, and had quietly stopped suggesting the hiking trips he and his wife Barbara used to take every fall in the Hocking Hills. "I just accepted it," Walter said. "I figured this was the trade-off for the career I had. My knees kept me coaching all those years, and now they were done." His daughter-in-law, who worked in integrative health, sent him a summary of the Boswellia research and suggested he bring it to his primary care doctor. His physician was not familiar with the compound, but reviewed the studies over the following week and found no contraindications with Walter's current medications, and he approved a supervised trial. Walter started with 300 milligrams of standardized Boswellia extract, 30% boswellic acids, 12% AKBA, taken in 2 divided doses with breakfast and dinner. At 4 weeks, he noticed nothing dramatic. At 6 weeks, he noted that his morning stiffness, the first-hour grinding that had become his daily alarm clock, had reduced noticeably. By week 12, he had completed 2 moderate trail hikes with Barbara. Not without discomfort, but with manageable discomfort. He reduced his ibuprofen use by more than half. His 6-month follow-up with his orthopedic surgeon noted no further progression in imaging and improved functional range of motion. "I'm not cured," Walter said, "but I got enough of my life back to matter." His experience aligns with what a 2023 clinical review of over 900 adults with knee and hip osteoarthritis, published in a peer-reviewed joint health journal, reported. Participants supplementing with standardized Boswellia for 90 days showed an average 47% reduction in pain-related functional limitations, and nearly 2/3 reduced or eliminated their use of over-the-counter anti-inflammatory medications during the study period. Section 6. The form and dosage. Where most people go wrong. This section is critical because the Boswellia supplement market is unfortunately cluttered with products that will deliver little to none of the benefits the research documents. Not because the compound does not work, but because the products do not contain meaningful concentrations of its active ingredient. Most standard Boswellia supplements sold in pharmacies and discount supplement retailers contain raw Boswellia powder with 2 to 5% boswellic acid content. At those concentrations, you are unlikely to see the joint-level effects the clinical studies report. The trials showing meaningful outcomes used standardized extracts, a very specific distinction. Here is what the research supports, translated into label-reading language. Look for standardized Boswellia extract with a minimum of 30% total boswellic acids. Look specifically for the AKBA percentage on the label. Aim for 10% or higher. The total daily dose in most well-designed studies falls between 300 and 500 milligrams. They're taken in 2 divided doses with meals. Fat-soluble compounds absorb significantly more efficiently when taken with food containing healthy fat. Olive oil, avocado, nuts, or fatty fish all create the right absorption environment. There's also a more bioavailable patented form called Amplifies, a self-emulsifying Boswellia extract developed to improve absorption. Research published in an International Journal of Medical Sciences found that adults taking Amplifies at 175 milligrams per day showed comparable or superior improvements in pain scores and physical function compared to those taking standard Boswellia extract at 300 milligrams. This means, for some people, a lower dose of the right form delivers stronger results than a higher dose of a standard form. On what to avoid, any product simply labeled Boswellia powder without standardization details. Combination formulas where Boswellia appears far down the ingredient list, often at doses of 50 to 100 milligrams, far below the research threshold. Products that do not list AKBA content separately, and any product without third-party testing certification, which confirms that what is on the label is actually in the capsule. One more practical note on timing. Do not expect results in the first 2 weeks. Boswellia is not an acute pain reliever. It does not reduce pain within an hour the way ibuprofen does. Its mechanism works by gradually shifting the inflammatory environment inside the joint. Most people in clinical trials begin noticing meaningful change between 4 and 8 weeks of consistent daily use. On stopping at 2 weeks because nothing dramatic has happened is the single most common reason people conclude it does not work for them. Section 7. The combination that changes the equation. The most significant recent development in Boswellia research is not about the compound alone. It is about what happens when it is combined with curcumin, the active compound in turmeric. The reason this pairing is so biologically compelling goes back to the two pathways we discussed earlier. Curcumin primarily targets the COX-2 inflammatory pathway. Boswellia targets 5-LOX. These are two separate but deeply interconnected inflammation cascades operating simultaneously in arthritic joint tissue. When both are inhibited together, the anti-inflammatory effect on the joint environment is substantially greater than either compound produces independently. A large-scale study published in a peer-reviewed complementary medicine journal assigned over 500 adults with knee osteoarthritis to one of three groups: curcumin alone, Boswellia alone, or a combination of both compounds at the same individual doses. After 16 weeks, the combination group showed the greatest reduction in pain scores, the greatest improvement in physical function metrics, and the lowest levels of C-reactive protein, a systemic marker of whole-body inflammation, compared to either single-agent group. The effect size in the combination group was described by the study authors as clinically meaningful, a phrase researchers use carefully. The practical protocol the research points toward: standardized Boswellia extract at 200 to 300 milligrams daily, paired with high bioavailability curcumin, specifically the BCM95, or Meriva phospholipid-bound forms, which absorb several times more efficiently than standard curcumin powder, at 500 milligrams daily. Both taken with a meal containing healthy fat. Both given a 60-day minimum evaluation window before drawing conclusions. Medical experts consistently emphasize that anyone currently taking blood-thinning medications, prescription anti-inflammatories, or immunosuppressants should discuss this combination specifically with their physician before starting, as both compounds have mild anticoagulant properties that may interact with pharmaceutical agents working on similar pathways. Section 8. What else Boswellia is being studied for? Because this is a deep dive, it is worth acknowledging that the joint research is only the most mature chapter of the Boswellia story. Several emerging areas of investigation deserve attention, particularly for adults managing multiple inflammatory conditions simultaneously. Brain health. Research involving older adult populations, published in a leading neuroscience journal in 2022, found that AKBA crossed the blood-brain barrier in experimental models and reduced markers of neuroinflammation associated with early cognitive decline. Human clinical trials in this area are ongoing. The findings are preliminary, but are generating significant interest in the integrative neurology community. Gut health. The 5-LOX pathway is also highly active in intestinal tissue, and a series of small but well-designed clinical trials have found that Boswellia supplementation reduced measurable markers of gut wall inflammation in adults with inflammatory bowel conditions. For the significant number of adults over 65 who manage both joint pain and digestive inflammation simultaneously, this is a potentially relevant secondary benefit. Respiratory inflammation. Several controlled clinical trials have documented improvements in lung function and reductions in airway inflammation. In adults with chronic respiratory conditions who supplemented with Boswellia extract, this aligns with the compound's traditional Ayurvedic applications and represents another area of growing scientific interest. These are supportive findings. The joint health research remains the strongest and most actionable evidence base. But the picture of Boswellia as a broad-spectrum anti-inflammatory with multiple systemic targets continues to develop. Action steps. Here is exactly how to move from information to action. Step 1. Before your next doctor's appointment, create a one-page joint health summary for yourself. Write down which joints are affected, your current pain level morning versus afternoon, on a scale of 1 to 10, what activities you have reduced or stopped, and what pain management you are currently using. Specific information transforms a vague, "my joints hurt" conversation into a clinical discussion your doctor can actually engage with. Step 2. Research standardized Boswellia extract products before your appointment. Look specifically for minimum 30% boswellic acids, AKBA percentage listed at 10% or above, or third-party testing certification, and no proprietary blend language that hides individual doses. Bring the product label, or a printed summary, to your appointment, so your doctor is evaluating what you are actually considering, not a generic category. Step 3. Ask your doctor directly. Given my current medications and health history, is there any reason I should not trial standardized Boswellia extract at 300 milligrams daily for 60 days? A specific, time-bounded question is far easier for a physician to evaluate and approve than an open-ended supplement inquiry. Step 4. If approved, begin at 200 milligrams twice daily with fat-containing meals. Keep a brief weekly log, 30 seconds, just a pain score and a functional note. What can you do this week that was difficult last week? Objective data collected over 8 to 12 weeks gives you and your physician something concrete to evaluate at your follow-up. Step 5. Do not let the supplement do the work alone. Boswellia reduces the inflammatory barrier that makes movement painful. But movement itself is what drives nutrients into cartilage through the diffusion process we discussed. 30 minutes of daily gentle movement, walking, water aerobics, chair-based range of motion exercises, or light cycling, creates the mechanical compression that nourishes joint tissue. The supplement and the movement are a partnership. Neither is sufficient on its own. We want to hear from you. Have you ever tried Boswellia, turmeric, or any natural approach for joint pain? What was your experience? What worked and what did not? Leave your story in the comments. This community reads them, learns from them, and someone watching right now may be waiting for exactly what you have to share.